Okay, welcome back to the lecture series on fundamentals of air pollution, sources, effects and mitigation. In this lecture, we are going to discuss toxicity. This is very important topic because we have heard during the period of COVID, what is the toxicity, how it is defined, how can we calculate the toxicity levels, what are the different terminologies that are used in toxicity, understanding the toxicity. I will give one very important equation that is used by US EPA for calculating the, usually toxicity is given in exposure dose in a way. So, toxicity, when I say, it's kind of a very generic term, general term. So, it's understanding the concept of toxicity is very important, and let's see how we can go in this one. Yeah. So, there are different terminology as I suggested. So, for example, you have poison, toxins, toxicants, then toxicity. Poison is usually defined by any agent that is capable of harmful response in the biological system, okay, including a serious injuries of the function or resulting in a death. So, this is actually poison. When we say that, what is actually, of course, it is a toxic because poisons are mostly toxic, as we say. So, toxic is a very general term in that one. And then you have toxins, okay. This is a general term that is referred to toxic substances. So, whatever the toxic substances that are there, they are generally referred as toxins, okay, that are produced by the biological system such as plants, animals, fungi and bacteria. And then toxicants, these are the terms that is used for toxic substances that are produced by natural or anthropogenic activities. So, you have to remember here the difference between toxic and toxicants is toxic is referred to the toxic substances that are produced by the biological system, okay, whereas toxicants are which are produced by natural and anthropogenic activities. Okay, so you have to understand toxins are that is produced in our body. For example, when I say our biological system, we say that sometimes people talk, oh, our body is very, you have lots of toxins and how to detox your body. So, when we say how to detox your body, this means it is not the external toxic, kind of harmful chemicals that are have been brought. It is because of the internal biological system that is functioning and which is resulting in a harmful substance. So, please remember. So, when we say that detoxing our body, this means we are trying to remove the toxic elements that are there in our body, and toxicants are actually which are produced by the natural or anthropogenic activities. So, this is very important. And when I say the term toxicity, this refers to the degree to which a substance can harm human, animal and the environment. Now, this is actually a kind of some sort of quantitative way. It is also not fully quantitative because there is no equation that is involved here, but when we say degree means to what extent. So, we generally define less toxic, high toxic, very high toxic, okay. This is something that we remember in our terminology. So, this means this is the degree. Again, this is a kind of qualitative term. So, toxicity is again a qualitative terms, and it is a measure of how poisons or harmful substance can be when it comes into contact with the living organisms, okay. So, toxicity only resulted when it comes into the contact with the living organisms. Until it is somewhere actually is there in the environment and it does not interact with the living organisms, we generally don't call it as a toxicants, because you don't know how can you define that one, because it has to have a harmful impact. So, when it will have harmful impact? When it will be coming in contact with the living organism. So, that is very important. So, toxicity is again a kind of sort of a degree. So, you have some sort of idea whether it is very toxic or not, okay. And there are actually, like, if you have to define this one toxicity further, we generally define in dose, then there will be a kind of another function that is actually response, and then there will be a relation between dose and response function, and then you do risk assessment. Okay. So, dose is usually defined as a chemical that is entering in our body and usually given in milligrams of the chemicals per kilogram of the body weight. This is very important. So, it is usually written at milligram per kg. So, dose will be calculated in this one. We will see that how this be different. There are different equations that can be used to calculate the dose and exposure dose in this one. So, but this is very important, and this is also, remember that this is the dose also when in the medical terms, when you are given, when in a medical treatment, what is happening, you are given some dose. It is, for example, once a daily, OD or BD, twice a day, or TD, thrice a day, something like that. So, this means the chemicals, if you are taking these chemicals, if you any medicines once a day, this means this will have effect in your body until 24 hours. So, for 24 hours this will be effective, and when we say BD means it will be effective for only 12 hours. After 12 hours, if you do not take the another dose, the effect of the dose will be minimum, or the medicines will be minimum. Similarly in the trice, and sometimes you are also defined like SOS. So, if it is kind of some emergent situation is there, and when you need, SOS means when you need. So, this is different kind of dose that is given, and yeah, this is again I defined this one. So, how often, duration, how often means how frequently, duration and time, and how the dose is administered are important parameters. So, if you see in the dose, you have a dose, the different parameters, what are the route of exposure. So, in order to calculate the dose or exposure dose will be when you are exposed to this one. When you are taking in your body, then it is generally called as dose. So, it will be depend on the route of the. So, we will discuss some of the cases, route of the exposure, then concentration levels, what is the level of concentration of that kind of toxic elements, toxicants that is there, then how long it is actually you are taking, then there will be another, you remember that one, you remember that all the dose, if you are taking medicines of say 100 milligram, it is not necessary that this 100 milligram will be completely absorbed by your body. There will be only limited absorption, the immediate absorption will not be completely. So, your body will be reacting accordingly, okay, and then you have kind of frequency, and then you calculate that get some kind of toxics, individual company variability like medical condition, genetic, age and gender. These are the important things that are there. And response is any change from an organisms in formal state that is irreversible, at least for a period of time, given period of time. So, if it is responding, then for example, if you are given dose OD, this response time will be, for example, for 24 hours or so. Then risk assessment is a process of identifying potential effects on human health. So, this is very important, and until you do the risk assessment, it becomes very important taking the dose and whatever the dose is actually you are taking. If you are not assessing that risk that is associated, then it is very important, because if you are taking in a high dose, means high amount you are taking, then it can have adversely affect your health actually. Or if you are taking in a low dose, then what can happen, your body may not respond to that. So risk assessment, you have to have kind of optimum dose for a person, that you have to divide that how much dose you have to be given in this one. So, factors affecting the toxicity, this is very important slides, and I prepared for you. For example, let's say that we are talking about the air, because we are talking about something like air pollutants. Now, in the air pollutants, I have also included here is case for the COVID, during the period of COVID also, although it is not very good time to remember again the COVID things that happens, but yes, it is sometimes important. So, in the atmosphere there are two types of actually COVID, they called it, that happens because of two types. One was airborne transmission and one was through contacts. Okay, this was the major route actually. Okay, and airborne transmission was not actually first of all adopted by WHO. No, it is not only they mostly had this kind of droplet transmission. So, you had airborne transmissions was neglected actually, and that was the biggest price that we probably paid, because we even let us see that how it is important that when in the air some pollutants are there, and I am giving you an example that you can learn with this one. So, in the atmosphere what will have, you have air, and in the air you have actually like particulate matter, you have gas, pollutant gases, and then let us say that you also have a droplet nuclei in the atmosphere. And when I say droplet nuclei is generally defined with the particle that size is less than 5 micrometer. This is how it is defined in the medical terminology. So, because I mean there are still debatable, and you can always ask that why it is 5 micrometer. But it is understood and it is studied that if the particles is more than 5 micron, it will actually fall out very closely or very fast. So, if it is less than 5 micrometer, your these are called actually droplet nuclei. Droplet nuclei means the small things. So, what is happening now? What is these are there in the atmosphere. So, what is there when we are breathing? We are actually inhaling, and during that inhalation process we are also inhaling these things actually, particulate matter, gaseous pollutants, and droplet nuclei. So, let us see what will happen. If you are in the particulate matter, if you remember my lectures, there could be actually soluble and insoluble components. So, soluble aerosols and then insoluble aerosols, and then you have actually SARS-CoV-2 virus that was there in the atmosphere. And the droplet nuclei. Remember, this is actually when we are talking in a very closed environment where the SARS-CoV-2 virus concentration in the air cannot be neglected actually. So, this is a lots of kind of debate were there, and I was trying to, my intention is here is to just give you a flavor that what kind of dose, we call it exposure dose, is needed that can cause you infection. Okay. So, I was talking about that what is the minimum dose or the threshold dose that actually if a person inhales can be actually can cause a COVID infection. So, this is actually if you know the threshold dose, then this becomes very important. Okay, this is for example you have other dose, you have exposure dose due to airborne transmissions, EDAB. So, if it is more than threshold limit, COVID infection per droplet mechanisms may be there, and this may cause mortality. But if the exposure dose due to airborne transmission is less than threshold limit, then it will be kind of chronic disease that can be developed, but it may not cause much of the mortality, or it may not be causing a kind of it may not be very dangerous to the human to the person. So that was there actually, that was the idea. Then let's leave another the other aspects of this one. So, about the particulate matter. So, you have two components, soluble and you have insoluble aerosols. So, if you have a soluble aerosols, what will happen? These soluble aerosols actually contains lots of toxic elements, metals such as iron, copper, zinc, and then other things can be there. These toxic metals, when they go in your body, they will generate some kind of reactive oxygen species. This is very important, and when they generate, they will affect the metabolism process. So, they will disturb your metabolism process, and then this can lead to a chronic respiration or COPD kind of issues. So, this is remember, okay, this is very important topic, and not much of the research has been done in this one. For example, we do not know that what kind of exposure dose is needed. Even we really do not know what are the exposure dose that can cause this kind of things. Then you can have if you have other component is actually insoluble, what it will happen? It will directly, for example, black carbon and dust. Now you must be remembering the terminology. So it will not do any chemical reaction, but because depending on the size, they can go deeper into your lungs, and for example, they can be deposited either on the alveoli surfaces or finer aerosols may block the airway passage of the lungs. So this kind of things can happen. So this is very important. And then if I just give you that what are the factors that are actually affecting, that can affect the kind of exposure dose, this actually concentration of the pollutants itself, the inhalation rate and exposure time. We will see how the equations can be used to calculate these things. Yeah, this is the equations that can be used to calculate the exposure dose due to inhalation of either particulate matter or gaseous pollutants. What you have to see? You have to EDPM means exposure dose due to particulate matter. This is the concentration. This is the inhalation rate. EF is actually kind of factor, exposure factor. Okay, this is exposure factor of the ith aerosol species. This is unitless, remember this one, and this is actually the body weight. Now, if you remember here, the unit of this one is actually be reported in microgram per cubic meter. Inhalation rate, for the sake of complexity, let us say this will be kind of meter cube per day. Okay, and EF, I will come to that one, how we can calculate EFI. So the time factor will come here. So if you just see this one, meter cube will be cancelled from here. You have something like microgram, and then you are dividing by the body weight, so unit will be kilogram. Now you need time unit here. So time, if it is here, then this time unit will be cancelled and you will have a microgram or a milligram. You can calculate that one accordingly. So you will be having actually like an exposure dose. So for example, so this is actually how these equations are related. So concentrations of the pollutant itself is very important, and then air average intake rate, for example, this varies from say 4.5 meter cube per day for an infant of less than 1 year to 15.2 meter per day for a male between 19 to 65 years or so. So you can see there is a huge variability. So the exposure dose for the different for a adult and for a infants can be different. So in principle, if you just see if you just don't consider body weights, everything remains same, these kind of kids, they will be the infant babies, they will be less prone because they are inhaling less pollutants. But again, there will be another function that will be there, that is how their body is actually immune, and BW is actually, I said that body weight per kg, and yeah, again in the air intake rate is actually influenced by the person's activity level. For example, physical activity level, whether he is sitting, he is driving or is walking, okay, different kind of activity, then physical condition, gender and age. So this is very important to calculate this one. And again, if you just see calculate what I said here, EFI, if you just remember in the previous equation, the exposure factor of the ith species, which was unitlet concentration, what will be here, the exposure for dose is actually this provides an estimation of average dose during the period of exposure. Okay, so this is sort of average dose that is actually given. And if you remember here, EFI was having unitless. So if you see here, FI is the exposure frequency, ETI is exposure time, and then ATI is average time, average time period over which a person was exposed to the pollutants. So you can calculate from this one that what is the exposure factor from here, and if you just put these equations together, you will have something like this. Okay, so you have in the previous equation you had CI, IR and BW, you had ETI. Okay, and then if you just remember the previous equation, yeah, EFI, emission exposure factor. So this can be actually calculated. Now the third equation that is dealing with the exposure dose, that because of the inhalation of droplet nuclei, and I said that how many number of viruses are inhaled by a person, and then you can, of course, you have to normalize with the body weight. So this equation can be calculated, and this, you remember, you have to calculate these equations where Ni is actually, here Ci is the concentration, and this is actually number of smaller droplets per meter cube of volume. Remember, here it is very important. And then Vi is the viral load. This people were talking actually that that how much actually viral load is, means the RNA number of RNA copies per ml of the solution or the droplet that you have. So you have to calculate that one also. Vi is the volume of the ith droplet in ml. So if you just calculate Vi and so you can calculate how much actually it will be there. Then IR actually intake rate or inhalation rate, ETI is exposure time, and ATI the average time of exposure. So this equation you can use to calculate exposure dose because of the droplet nuclei. So these equations, because here actually it's, Ni is actually number of droplet, so you can calculate this one. If you just calculate, you will see that the exposure dose will be actually given in number of COVID virus that is inhaled per kg of the human body. So if the but then again this was a very big problem, and the problem here is that here this equation does not consider the immunity. Okay, there is a problem with the immunity. This equation does not consider that how the person is immune, whether the person may be having very good immunity. So if somebody is having very good immunity, this exposure dose, even if the exposure dose is very high, but the person is having high immunity, he may not get actually that infection. So that is again very important. So remember, these are the not very simple equations. Then there are lots of actually complicated equations came, we tried, but just remember this is the basic lectures. Now if you want to work more on this one, you can just use go further, that how this Ni will vary, how the Ci will vary, how the other things are going to vary. Okay, and so this equations assumes the absence of viral shedding. Okay, the virus itself will be decaying, and the loss of infectivity of the virus due to exposure to the ambient condition. These are lots of research activities were done, that how the droplet nuclei is there in the atmosphere, and if the harsh condition is there, and then you remember India paid a huge price of this one, because some of the research that came that they say that okay, because it is going to be summer, and in summer what will happen, the temperature will be rising, and when the temperature will be rising, these droplets will be actually they will be evaporate, and then this virus will not survive. Okay, this was the kind of hypothesis that was given, and that was a very wrong hypothesis, and lots of things happened in between, lots of research came, but of course the virus does have a kind of viral shedding, but it does not actually completely gone. So the virus will still be there, and it can be still infective in this one. So temperature, for example, temperature, humidity, then particulate matter loading, lots of research were done, that what will happen to this aerosols, because India is having very polluted country. So these aerosols might be actually neutralized with these aerosols, the droplet nuclei that are there. But yes, it didn't work actually, lots of, and then this is another very important issue that we have to consider in this one. So there are another terms, like for example, how to evaluate toxicity. I said that you have to calculate exposure dose. One is actually called as a lethal dose, LD means lethal dose, and lethal dose 50, LD 50 means the amount of material given all at once which causes death of 50% of the group of the test animals. So if you have 100 numbers, that is for testing, and if you give administer a dose, if there are actually 50% death, then that is actually called LD50. So just remember, And similarly, if it is actually there are also LD1 or 1%, so you can have LD 1%, okay, you can have LD 100%, all the population dies actually, there will be nothing left actually, there will be no kind of the one. Then LD low, lowest dose causing lethality, or you can also call it, this is actually the threshold limit, okay, and then the lowest dose that can cause TLLO means lowest dose that can cause toxic effects. So there are LD stands for lethal dose, and the subscript, if it is 50 means it can, if the dose is given to 100 kind of animals, 50% will die, and 1% means 1% of the test population will die, 100 means all of them will die. So this is, remember, this is very important. And then lethal concentration, this is LC, okay. So I told about LD, this is the concentration of the chemicals in the air that kills 50% of the test population, okay, during the observation period. So LC 50 like LD 50 is actually lethal dose. So the unit actually you can say here it will be microgram per kg, okay, but here this unit can be actually, because we are talking actually in the air, so what is the minimum dose of concentration, and this LC 50, if you remember, for example NAQS, they use to define that if the concentration is above this limit, then that can have actually kind of infection, kind of toxic effects, but they do not define that how it is actually happening and how much dose can affect this one. Then of course duration and frequency. Acute exposure to a chemicals for less than 24 hours is called actually kind of acute exposure. This is a single administrative or repetitive exposures may be given within 24 hours of some slightly toxic or practically toxic chemicals. Subacute means kind of the exposure, repeated exposure to the chemical for about a month or less. Subchronic means exposure about 1 to 3 months, and chronic means you have more than 3 months. So if this is terminology that is adopted in medical as well actually. So if you are having if the doctor says that you are actually chronic patient, so this means this person is actually affected by the kind of more than 3 months or so. So if you are continuously affected, then it can be there actually. And then significance of dose specific test. Acute means this describes that subject can tolerate a dose level over a shorter period of time. Chronic, subchronic shows more complete picture including hematology or histology. So acute means just took, it may not actually in the hematology or histopathology you may not see any differences, but if you have actually subchronic dose, then it can be actually affected. And then chronic means this can assess the potential of lifelong health impacts from the repeated exposure. So this is very important. So if you are chronic means is for a longer time. And this is how the dose response function happens. If you increase the dose here, what is happening here, this measured response is will increase and it will reach to a maximum. This is called maximum efficacy. So beyond that it will be kind of saturated. So that kind of hypothetical dose response curve has features that vary potency, location of the curve along the x-axis, along the x-dose, then maximal efficacy or ceiling effect, greatest attainable response. Okay, so if you at this level, what will happen if you still keep on increasing the dose, the effect may not increase at all. So the effect may be same. And slope, this can determine how quick or how slow a person is responding. So this is also very important. These are some kind of another linear dose response or threshold dose response or non-linear dose response. There are different types of responses that can happen. Linear means the response is increasing proportionally with the dose. So if you give higher dose, the kind of response will be higher. Threshold means there is a dose below whose no detectable response or nothing will happen, above the threshold the response increases with increasing dose. Non-linear, this does not increase proportionally with the dose, so we are not sure whether it is a non-linear or not. This includes various shapes such as sigmoidal or bell-shaped shape kind of things actually. So this is actually like non-linear dose curve, so it will, we don't know here actually, okay. And if you have a kind of linear dose here you have a kind of ceiling dose, this is the threshold level that below which there will be no effect on this one. So yes, this is actually about toxicity, and toxicity is very important. You can calculate for any chemicals or air pollutants that is there in the atmosphere. I gave it very brief because we have to cover lots of discussion in this topic in the course, and then unfortunately the course is little bit big, so will not go much more details, but I hope this will answer some of your queries, and you will understand this very well, that how it is important and why it is important. So how you can assess the toxicity and how you can learn about more about the toxicity. So I will stop here. Thank you very much.